So, specifically, this study was driven by three humans from our senior storytelling team here at Authenticx. That consists of Sally, Olivia, and myself, Phil. And the three of us will be sharing in these videos the findings of this study. But first, what is an inside storyteller? Well, as storytellers, we analyze and share the results after the AI structures the data. So we have a lot of experience in this world of healthcare and data. And usually we will listen within a specific vertical and a specific company and a specific department. But as we shared, for this work, we zoomed all the way out. And in these videos, we will present what we studied, what we discovered, and the impact. So, what did we study? So, to answer that broad question, why are patients missing treatments? We used our most sophisticated AI model, the Eddy Effect model, which allows us to identify conversations in which a patient or caregiver's desired experience is disrupted by an obstacle that causes the customer to feel stuck in a problem. Kind of like how debris or a boulder in a river causes the river to swirl. So, specifically for this macro analysis, we drew from just over 1 million Eddy Effect conversations. And from those 1 million Eddy Effect conversations, we pulled a statistically representative sample of those Eddy conversations. Now, we didn't just stop there, we pulled a specifically representative sample of Eddies that had an impact of delay in a patient's treatment. So we ensured that these calls came from all three of our major healthcare verticals. So that includes the provider space, where patients are trying to schedule appointments or get refills or seek medical advice, from the payer space, like members trying to understand their benefits or submit claims, and also from the life sciences space, where we listen to patients who are trying to get financial support to pay for their medicine. So we drew these calls from Q4 2023 to Q2 2024 to capture the seasonality of conversations in the healthcare industry. And what we mean by that is we wanted to capture times where there's a lot of intense conversations taking place around annual topics like Medicare re-enrollment for financial assistance. But we also wanted to capture times in the year where there's not that intense conversations taking place as regularly, so that we could kind of reflect all seasons of the healthcare experience. And we also made sure that each call was human validated so that we could use every single one of our tools at our disposal. So, in order to get to this overarching question of why are patients missing treatment, we asked four sub questions of the data. So, first, we asked who was involved in the discussions of the delays. Every single uh, entity that is mentioned, including patients, caregivers, pharmacies, everybody. We also discussed who was often seen to be responsible in these discussions for those delays in care. We also asked where did those delays seem to begin in the patient's journey? And we also asked who was most often designated to bring about the resolution to this delay in care.